So maybe by this we will be able to combat the various risk factors to a very large extent. And I always believe a very nice statement which me and Dr. Manchanda has shared on various platforms, and that is, if we have a kindness in words, it creates confidence. Kindness in thinking creates profoundness. Kindness in giving creates love. And kindness in loving creates happiness and a healthy heart. Love is free. There is no cost, but I don't know where do we keep it. It's not expensive at all. But why don't we share and care? It's a matter of concern. I think Dr. Manchanda was very categoric. He's a hero, I think. And he mentioned that make your mindset robust and perfect if you want to have a healthy heart. I think that's a very important message to prevent the heart attack. I think beautifully expressed by everyone, every expert panel, that we have to prevent heart attack. That is the main agenda. If you take Indian scenario, we see a lot of heart attacks in southern part of India, and the risk factors are different. And a lot of heart attacks we see in northern part of India, where the prevalent factors are different. Just two example. Say, for example, a lot of studies has been done, huge data. And we find if we make a zonal expression from south zone, east, west and north, in northern side, the dietary factors are very, very important. People consume wrong food at the wrong time, in the wrong place, in the wrong dose, in the wrong environment. And some of the factors in south are different. We consume different kind of oils, and they are having a different factors. But stress is dominant factor everywhere, whether it's a northern part or the eastern part or western part. There are various factors. When we say heart attack, it is not one factorial, it's a multifactorial. Some places factors are dominant. You take Chennai, for example. The diabetic prevalence is very high. If you take Punjab or Tamil Nadu, diabetes is very high. So there are different risk factors at different places. But if you take the overall picture, I think most of the risk factors are same. The only difference is at some places, some factors are more and some factors are less. But we must make sure that we create a balance in all the risk factors. And moderation is the key in our exercise protocols, in our thinking process. Dr. Manchanda was very specific that I plan to exercise, but my other mind says, no exercise today, you have to go for a walk. So I think we all need to set our mind. If we set our mind, the risk factors, single factorial or multifactorial, can be taken care of. That's a real message from our panel. In winter, the prevalence of heart attack is to a higher extent. The reason is very clear, because we are highly vulnerable to get a shoot of high blood pressure, and then we have sedentary lifestyle, and we have a peripheral vasoconstriction as well as the constriction in the arteries, narrowing of the arteries, and we eat the diet which we don't eat throughout the year. We eat a lot of gajar ka halwa, and we don't exercise. You know why we eat? Because we have poor mindset. We don't know what we are doing. We are abusing our body. So I think in winter, it is seen that there is a little peak and increase in the heart attacks, because there is a tendency for clotting more as compared to summer. There is a little difference in the winter. I agree with you. And hypertension also is very, very common in the winter. Stroke rate, even I have seen a lot of sudden deaths more common in winter. Roxani, yes. Any opinion?
The two important factors. One is the temperature varies from 1 degree in winter to 45 degrees in summer. This is not seen in the southern part or in the tropical area like Mumbai and Goa, where it's 20 to 40 degrees. We did a study on that, as Dr. Chopra rightly said, about the blood pressure part, and we started looking into the causes. We found approximately 50% or 60 or 100% increase in doses of the antihypertensive drug is required in winter compared to in the summer months. And the reason which he has already said, there is a loss of sweating. So the salt remain inside, water loss is not there, blood vessels constrict, vitamin D is low, pollution is there, and our festivals are also very high. We exercise less, we smoke more, we drink more. All those factors leads to increase in the risk factors, particularly the diabetes and hypertension, and also the platelet aggregation becomes more. So they result in increased heart attack, heart failure, kidney failure, everything comes in the winter. And vice versa is true during summer. When we sweat, there is a water loss, there is salt loss, we exercise, and the blood pressure becomes a little lower. So that is very,
It's the extremes of weather, extreme cold and extreme hot. They are all responsible. What is your opinion? I think Dr. Sani just mentioned about vitamin D. Do you think the reduction of vitamin D, deficiency or insufficiency of vitamin D, make us more vulnerable to stroke and heart attacks and high blood pressure?
It makes vitamin D is emerging as one of the important risk factor for occurrence of a vascular disease, whether it is a heart attack or a stroke. And as a part of the preventive assessment, most of the program incorporate the assessment of vitamin D, and we should be aware of that this is one of the important, it has an important role. Now, just mention about this prevalence in the different part of the country. I haven't come across a very organized data, but what we have been seeing that, and I see in my native state in Chhattisgarh and the central India, if we see that part of the country, one peculiar trend I have noted, and the Medical College of Raipur is studying this pattern. One is that if we see the central Indian population, their smoking prevalence is very high. Like North India, diet is the playing role, South it is probably diabetes is playing role, Central India is smoking prevalence is very, very high, including among the women. Now, second is that we have noted there, even in the summer, like in Delhi or in North India, we see the surge of the patients with the heart attack and sudden death coming in the winter month, but there they have found equal number of patients getting admitted in the summer, because that is the June. In fact, this United Nations has declared that the central India is going to face a heat crunch, and that population is suffering from a kind of a heat crunch, and many of these patients, I have performed procedure there, they have just like as Viveka mentioned, just a thrombus. In the peak of summer they have come with heart attack and it was just a thrombus, nothing else. So that factor need to be studied further, and it has definitely a role.
I think Vinod Sharma and Dr. J.P. Sani has given a very important point, that the extremes of weather. Dr. Vinod Sharma has said in Chhattisgarh area where there is extreme heat, in extreme heat, when there is a heat stroke, they may have a cardiac stroke also, and the cause is again a thrombus. Sir, Dr. Manchanda, you want to say something?
The variation of the heart attacks are very well known. Early morning, between 6 to 8 o'clock, especially Monday morning in the Western countries, the catecholamic surge is very high. So we suggest people should try to decrease it by doing yoga. Yoga was classically done and it can decrease the catecholamic. So it is very well known that early morning is the worst period before you go to the office. The another bad thing which can occur, you see, when we had the maximum pollution in our country, this was true in China also, the heart attacks increased. And the third factor could be fear. There was an earthquake in Los Angeles and the heart attacks increased in that region for the next 1 year. There was a terrorism attack and the whole population is affected. This psychosocial factor, these are very well documented. After 9/11 in the United States, the heart attacks in New York increased. So any psychosocial factors acutely can also affect it, but the seasonal variation and other things are very, very important.
Some people come in time, some people come quite late, the heart is damaged, and some are already brought in dead, having a sudden heart attack, and they are brought in the ambulance, and you do resuscitation, and nothing is there. What do you think is an important thing we should do?